Hello, my name's John Wilding. I'm Professor of Medicine at the University of Liverpool and also part of the steering committee for the DECLARE-TIMI 58 trial of dapagliflozin and cardiovascular outcomes in people with type 2 diabetes. I'm going to talk a little bit about this trial, but first I think it's important to set the scene. SGLT2 inhibitors are a relatively new class of glucose-lowering drugs that work by increasing glucose excretion in the kidneys and have been shown to be effective at reducing HbA1c, body weight, and also blood pressure. Other studies with SGLT2 inhibitors, including the EMPA-REG outcome study and the CANVAS program, have shown that these drugs are particularly useful at reducing heart failure hospitalization, cardiovascular death, and also major cardiovascular events in people with type 2 diabetes. The particular point about these other trials was they mostly included people who had prior cardiovascular events, whereas DECLARE has recruited over 17,000 people with type 2 diabetes, and 10,000 of those people had not had a prior cardiovascular event. They just had diabetes plus at least one other risk factor. The main outcomes of DECLARE, which lasted for 4 years, were that there was a clear reduction in heart failure hospitalization and cardiovascular death, which was highly significant in those people with type 2 diabetes. This was true for people who had had a prior cardiovascular event, and the same trend with no difference in heterogeneity was seen in people who had not previously had an event. DECLARE did not meet the other co-primary endpoint of 3-point MACE, but there was a trend which was similar to what was seen with the other drugs in the class. And in fact, a later meta-analysis published at the same time as the DECLARE study demonstrated that there was no heterogeneity between DECLARE and the other trials for this outcome. When we look at the breakdown, however, of those patients who had major cardiovascular events, heart attack, stroke, or cardiovascular death, we can see that most of the reduction in all the trials was in those people who had prior cardiovascular disease, with no reduction seen in those people without prior cardiovascular disease. Another very important set of findings from the DECLARE study relates to adverse events. There have been a number of concerns in diabetes trials with SGLT2 inhibitors, particularly around adverse events such as ketoacidosis, fracture, hypotensive events, and also amputations of the lower limbs, which were particularly a problem that was seen in the CANVAS trials. In DECLARE, it was very clear that there was actually no increased risk either for amputations or for fractures. There was a small excess risk of ketoacidosis, but this was rare. The final point in relation to DECLARE relates to a problem with bladder cancer that was detected in the early phase 3 development of dapagliflozin, and there was in fact no increase in bladder cancer, and in fact a statistically significantly lower rate of bladder cancer in those people treated with dapagliflozin in the DECLARE study. And I think this makes an important point, that we should not overinterpret rare adverse events seen in early phase trials. We really have to wait for definitive data before we can draw firm conclusions. And one other final point about adverse events is a very recent concern had been raised about Fournier's gangrene in people with diabetes treated with SGLT2 inhibitors. And again, with the DECLARE study, we actually saw less numbers of patients with Fournier's gangrene in the SGLT2 inhibitor group compared to the comparators. Now, if we put all of this into context, what does it mean for the treatment of people with type 2 diabetes? Well, what we do know, and it's very clear from DECLARE and the other SGLT2 inhibitors trials, that SGLT2 inhibitors significantly reduce the risk of heart failure hospitalization and cardiovascular death in people with type 2 diabetes. And this is irrespective of whether they have previously had a cardiovascular event. So that means we should be considering SGLT2 inhibitors for a much higher proportion of people with diabetes who may be at risk of this often forgotten complication of diabetes. In terms of reduction of major cardiovascular events, there is no doubt that there is no increased risk, which was always a concern with many diabetes drugs, and there does seem to be some reduction of cardiovascular events in people who've previously had an event, meaning that we should be certainly considering SGLT2 inhibitors in people with diabetes who've previously had a cardiovascular event. Overall, I think the DECLARE study confirms the safety of SGLT2 inhibitors and shows that they can be used in a very wide group of people with diabetes without major concerns.